3.
Good Saturday morning to everybody, and welcome to HyperFit MD Radio Show, along with Dr. Charles Guglin and Francesca Guglin. I am Gary Byron. Good morning,
Yes,
folks.
you are.
Good morning.
Well, nice to see you again. How has your week been?
It's been good.
Good.
Yeah? What have you been up to?
We always say good anyway.
Well, that's true. Yeah. Well, tell me more details. What made it good?
Well, we're a business.
The weather's
have a good-
changing.
Well, that's true, too. Yes. Very good point.
We were in Miami.
You're in Miami.
We were in Miami.
Nice.
Yep, for
And last time I think we chatted, you were telling me you were in New York City. So
Yeah. We were at a
jet-setting
conference.
Right.
We were at we were at an age management conference
In Miami.
in Miami.
Wow. Nice. What'd you think of it?
Oh, it's awesome.
Was it hot down there, though, I'll bet?
Yeah, it was hot, but you're indoors.
We were indoors all day. But
Yeah, Francesca works these conferences because she's the education director for Age Management Group, and so she's there directing education, and I'm there to learn stuff. So I'm in classes all day. I'm in conferences all day long. So
What kind of seminars are there?
oh my God, there's regenerative therapy, like we talked about last week.
Yep.
Hormone replacement therapy. A lot of stuff about hormone replacement therapy and things like that. There's always conferences about the baseline medicine that we practice, and then there's always stuff about the brand new stuff that's just coming out.
It's continuing education as a doctor.
Absolutely.
Continuing education.
Yep, you got to be a work in progress. You're not doing anything for your patients.
You ever thought about teaching?
We do. I mean, there's teaching going on in our practice every day. I always tell patients that our practice is curriculum based. We're constantly giving them reading material. Anytime somebody calls me with a problem on the phone, I don't just say do this, do that. I explain to them why it is they're doing it, explaining to them the physiology of why we do what we do.
Okay.
Because my attitude has always been the compliant patient, the patient who's going to achieve their goals is the patient who understands what they're doing to make their body work better for them. I mean, if you teach somebody, it's the old adage: if you give somebody a fish, you feed them for a day. If you teach them how to fish, you can feed them for a lifetime. And it's like that, especially when it comes to things like diet and things like that. So we are teaching every day. I used to give conferences. It's kind of a marketing thing for us. We used to do dinner talks, and we went all over Southern Connecticut doing dinner talks for people, basically just to let them know what we do and introduce them to the different way we practice, the way our practice kind of flies in the face of conventional medicine. So yeah, there's a lot of teaching going on.
Francesca, what are your duties down at conferences like this?
I'm the education director for the AMMG, so I basically educate doctors and kind of guide them to doing preventative medicine and offer them a certification program. So that's my duty. I literally work from 6:30 in the morning till 7:30 at night.
Well, isn't that fun? 13 solid hours of nothing but educating doctors.
I enjoy it. It's fun.
Were you able to get away at all at any time? Your time down
Just
there?
the day before, we just went one day early and sat by the pool.
Beautiful. Jealous. I mean, it's nice around here, but it's not Miami kind of nice. But before we get into today's topics, I mean, you gave me the ultimate teaser that I wouldn't be doing my job unless I asked the following question. Excuse me. What's in the pipeline? What are you being educated on? That maybe some people can look forward to.
Good question. What we're going to talk about today, there's always stuff going on about peptide therapies because there's new stuff coming down the line all the time. Last week we talked about regenerative therapies. You're constantly moving forward in terms of improving the way those kinds of things are done. There's new literature coming out about hormone replacement therapy every day. You need to learn about all that stuff. You need to keep up on the hormone replacement realm as well.
Prostate cancer and testosterone.
Yeah.
Morgan Fellow.
Yeah.
Great.
Yeah, this guy Abe Morgenthaler, who has pretty much done all.
He's a Harvard professor.
Oh, pardon me.
Yeah. well.
Yes,
You're right.
Yes, thank you very much. Yes, I'd like to introduce you, Lovey. Come here for a minute. Get off the yacht and come here.
Yeah, that's true. Yeah,
He's
yeah.
really down to earth.
He's a
Oh
very
my
nice
God,
guy.
he's a really
Oh, good.
Yeah,
Oh, yeah, that's
yeah.
good then.
No,
we'll
he's
give him a
down
break.
to earth, and yeah, he's made so many studies for these poor people that have had prostate cancer. And, these poor men. You can have testosterone therapy, and it is safe, and it protects you against getting cancer again. So he's got all these clinical studies, which is opening doors for a whole group of men that are going through this. Yeah.
I would imagine, and I want to get into our topic today of peptide therapy, but just one more question when it comes to the continuing education.
Mm-hmm.
It's not like it. When I say it's ongoing, I mean since you became a doctor,
Yeah.
You have to.
You're always because medicine is always changing.
Yeah.
Definitely. The internet is awesome. I can be honest with you, man. It's totally changed the way I learn things. Obviously, it's changed the way we all
we all
learn.
have, yeah.
We all. But just look, I learn from my patients every day because we see there's so many biohackers that come into our practice that people who are completely into physiology and things like that, and they're no different than any of us. They're on the internet all the time, and they're constantly asking me questions that I do not have the answer for. So I'm looking things up all the time, and the internet has made it so much easier. Look, I'm old enough to remember the days when I had to go to a medical library to look stuff up.
Sure. But how do you discern fact from fiction on some of these websites?
I don't go to websites. I basically go to PubMed, places where their literature is published. And then you have to discern whether it's good literature or bad literature.
Well, okay, that was my next question then.
Yeah.
Because just because it's printed in something that's legitimate,
Yep.
does that necessarily validate it? Or
Absolutely not. You can massage data to tell you. You can massage data to say whatever it is you
well,
want to
whoever's
say.
paying for the report, or yeah.
That's a little paranoid, but yeah.
Well, no, I think there's some truth in that.
Absolutely.
I
but
could get
that stuff,
three opinions. Whoever you tell me who's paying for the study, and I'll tell you how the result is going to be.
That stuff very seldom though makes its way into the kind of the standard journals, New England Journal of Medicine, places like that. Those kinds of studies basically make it into. It's all important stuff to read. Okay, it's all important stuff to read, but you always have to read it with a jaundiced eye. That's the thing. You can't just read the abstract. You got to read everything that's underneath the abstract to figure out how they did it, where they came up with, what it is they said, things like that. And one of the good things about coming to these conferences is it's very distilled for you. You're getting fed this stuff. Somebody else has already distilled it for you. And so you're getting a lot more information in a very short period of time than if you were just all looking it up yourself. And it's collated in a way where it's understandable as well.
You spend a lot of your time reading, I take it.
Sure.
Yeah,
Yeah.
makes sense. All right, let's go. Today's topic of conversation is peptide therapy. You've referenced that just a moment ago, but I think we've talked in previous shows and past weeks. The word peptide has come up, so let's explore that a little bit more. What we'll start with something that's very elementary, which is what is a peptide?
You know what a protein is, right? Protein is a string of amino acids. A string of amino acids greater than, let's say, 40 to 70 amino acids becomes a three-dimensional object because it starts to fold on itself, okay? So it can sit on a receptor or whatever. That is a protein. A peptide is simply a shorter string of amino acids. Some of the peptides we use are 20 amino acids, even smaller. Insulin is a peptide. Many things that we think of as hormones are actually peptides. And your body makes thousands and thousands of them. And many of them are useful in a therapeutic way. So that's what peptides are. It's just it's a tiny protein is what it is.
I guess I don't hear much about peptides anymore. I wonder, is there a reason why? Or
Well,
I used to, but
No, the reason why, and I gotta be honest with you, I don't really understand the legality about it, but the pharmaceutical industry is not really allowed to take something that the human body already makes and then upsell it in its pure form to you as a pharmaceutical, okay? the bioidentical hormones, for instance, that we use in our practice, okay? They're exactly the same molecule that your body makes. So to a large degree, unless the pharmaceutical industry can add a carbon group to it or something like that, give it another name, and then sell it to you, they're not interested in it. Peptides are very simply, the peptides that we use, the therapeutic peptides that we use in our practice are molecules that your body already makes for a specific purpose. Classic example is a peptide called BPC 157. BPC 157 is a peptide that is present in the secretions of your upper GI tract only when you're healing a wound of some kind. For instance, if you had a healing ulcer in your stomach, okay, and we went down with a tube and we aspirated some of that gastric contents, we would find BPC 157 in there. It's called a healing peptide. We use BPC 157 a lot in the practice like ours for people with, and I'm not claiming this is a cure for it, but it's very helpful for the symptoms of things like inflammatory bowel disease, Crohn's disease, ulcerative colitis. It's very useful in the upper GI tract for things like that, chronic gastritis, things like that. Many people use BPC 157 in the area of a chronic wound. We talked last week about regenerative therapy. If you have a sore, let's say you have tennis elbow, okay, and you inject BPC 157 in the area of that sore tennis elbow, you do achieve some level of healing in there, and it does help it to feel better. But the effects of these peptides are very subtle. In this in the world at large with healthcare, we're used to taking a pharmaceutical and feeling a change, right? You take Valium and your anxiety goes away. You take ibuprofen and your headache goes away. All right. You have a lot of back pain. You take a little Flexeril and the muscles relax. Those kinds of things. The effect that you get from these peptides is extremely, very subtle. It's an effect that you feel over time. You don't feel something come on as you use it. It's something when we get people on a peptide therapy for a specific reason. And we'll talk about another one in a second. I usually tell them commit to 2 or 3 months here because you're not going to see, commit to 2 or 3 months because you're going to see the effect as being cumulative over time as opposed to taking a pharmaceutical and feeling a change right away. Another one that we use a lot, it's a mix. Let me back up a little bit. In practices like mine, age management practices, for years they've used growth hormone. Human growth hormone. Human growth hormone is utilized for a lot of reasons: building muscle, burning fat, improving bone mineral density. Growth hormone is an amazing substance, but anytime you give somebody an exogenous hormone, you give them a hormone from outside, you're turning off a feedback loop. Okay, because everything in the endocrine system is a feedback loop. Okay, so if you give somebody growth hormone to a certain degree, you're turning off their hypothalamus. All right. There are peptides. There's several peptides that are called secretagogues, and what they do is they're called secretagogues because they stimulate your hypothalamus to squirt out your own growth hormone. All right, so you're helping your body increase the levels of growth hormone in your body by giving you something that just stimulates the hypothalamus to make more growth hormone, as opposed to just giving somebody growth hormone. So these. One of them is called ipamorelin.
Well, that seems more natural, right?
Yeah, I believe it's more natural, but it's also more subtle. It takes time to get the same effect.
I didn't mean to interrupt you, but go ahead.
Okay. It's all right. Why do babies sleep? Why can you throw a hand grenade into a baby's room and they sleep right through it? Right. Because they get between 2 a.m. and 6 a.m. every night. Every night they get a huge spike of growth hormone. Okay. As we get older, that spike becomes more attenuated. By the time you're my age, you don't get much at all. I mean, there's not much coming out of there, right? By the time you're 65. One of the most classic patterns of sleep that we hear in our practice in terms of a complaint is that I get to sleep fine, doc, but around 1 o'clock, 2 o'clock, I wake up and my brain's going like this and I just can't go back to sleep.
Oh, I thought it was I wake up because I got to pee.
Yeah, well, there's that too. There's that too, but then they can't get back to sleep. And one of the reasons is because that attenuated spike of growth hormone. So you give them a secretagogue, and the ones that we use for the most part is a mix of one called CJC 1295 and ipamorelin, which a lot of people have probably heard of because that's been around for a long time. And it's in a tiny little insulin needle. You give yourself a little shot right before you turn out the light. You sleep like a baby. It's pretty remarkable. Obviously, we don't go right to that. I mean, we talk about melatonin. We talk about, do you read your computer right up until the time you go to bed, stuff like that. We work a lot with sleep in our practice, helping people get through it. But that is one of the things that we use, and it's a simple peptide. It's something your body already makes that we have compounded for us in compounding pharmacies.
Wow, this is fascinating.
Yeah.
So it can be used for just about anything. It sounds like.
Well, that's on the side. The ones I just told you about that we use for sleep. A lot of guys use it also because it helps to burn belly fat, like growth hormone does, and it helps to build muscle as well.
Well, I think next time you come in, give me some of that stuff that burns the belly fat. Then.
Yeah, we will.
You should do the next recording in our office. That's what you should do.
Well, all right. So, to that point, we're working on something. We're still in April. If I'm not mistaken, is something being worked on for May? I don't know if it's necessarily in 2 weeks, but I think there's something happening in May in which we are going to be doing something in Milford. I don't know if it's literally in your office, but something's going on somewhere.
Like a Chamber of Commerce thing or something, you mean?
It was being worked on about a month ago, and I don't know if somebody just dropped the ball on it or if it's, or I just presume that, because I haven't heard anything about it, that...
I don't know anything about it.
You haven't heard anything about it.
Nobody tells us anything.
Well, Simon was working on it, and I know Simon's out of the picture, but, I thought he was...
He's in charge of the chamber now.
Temporarily, though, right?
I think so.
Yeah, I don't think he wants that position. Somebody said that.
Yeah.
It's too bad.
I think he's in place until they get a new person.
Like an interim.
Right. Exactly.
All right. So I guess I think I've. Let me do this because I'm up against a clock. I only have about 10 minutes left. You're listening, folks, to HyperFit Radio, HyperFit MD Radio. I'm sorry, HyperFit Radio, Age Management Center, located in Milford, as we were just referencing. Now my mind is like, what in the world? Who brought it up and in what context? Because I'll talk to you when we're done recording because I think I have a little bit more information about it. But I want to make sure I'm giving you correct information. If I'm going to say it on the air, I definitely want to make sure it's factual. With Dr. Charles Guglin, Francesca Guglin, I'm Gary Byron. Okay, so I guess the next question is where do you get them?
Come to Dr. Guglin's place and talk to him.
Well, that narrows it down. I wonder why he said that.
Yeah.
They get compounded.
We get them from compounding pharmacies.
Okay.
And there's a lot of people out there who are educated about peptides and are buying them on the internet. That is a wrong place to get them. It absolutely is a wrong place to get them. They need to be compounded at a compounding pharmacy.
What does that mean? You got to be compounded.
Well, pharmacies in the 40s and 30s and 40s, if your doctor wrote you a prescription, you went to a compounding pharmacy, and a pharmacist got underneath his hood and he made a witch's brew that was the medicine that your doctor prescribed for you. Compounding pharmacies are the original pharmacies where they are literally making stuff to order for doctors who need it. So unlike the pharmaceutical industry, which basically cranks out pills, and you get a 25 milligram dose, a 50 milligram dose, or a 100 milligram dose. That's your only chance. That's your only option. And nowadays, all you get are generic pills for anything, especially if your insurance is paying for it. You're only getting generic stuff, which, I don't want to sound paranoid, but by the same token, I'm very suspicious of a lot of stuff that's in generic medicines. But,
well, I don't want to get off the beaten path here, but some generics are fine and nearly replicas of the originator, and some are so off base that
it's tough to know.
Yeah,
it's impossible to know.
You think that's true? You can validate that statement, then.
Yeah, I think it's tough to know.
Yeah.
But anyway, the compounding pharmacies, for the most part, make stuff that the pharmaceutical industry doesn't make. Thyroid, for instance, we do a lot of work with thyroid in our practice. Actually, we should do one of these things on thyroid. There are very specific medications made by the pharmaceutical industry to help treat thyroid disease, mostly hypothyroidism. In our practice, we have very specific measures, very specific concoctions, if you will, of thyroid medication that we have compounded for us. We should probably do a show about thyroid.
Okay.
We'll talk about that in later. But the main thing is that it allows me to tweak dosing ad infinitum, okay, in terms of treating patients. It helps me do precision medicine as opposed precision medicine. That's what we call it, precision medicine. Because in our practice, every patient is an N of one study. I basically try to approach every patient as if they're a scientific study and they're the sole subject in a scientific study, the goal being helping them to achieve whatever their health goals are.
So just to be clear,
and peptides play a role in that.
And you're compounding them?
At a compounding pharmacy. No, we use
You use a compounding pharmacy?
Yeah.
Okay, I'm clear now.
Oh, boy.
Well, no, you differentiated that for me, and I appreciate that. But the only part I was unclear of was if you were actually I know you're not a pharmacist.
No way. No. Yeah. But I sucked at chemistry.
Did you?
I was
really?
terrible. Yeah.
You're a doctor.
I know. Well,
biology, you knocked it out of the park,
Yeah,
right? But
right,
yeah,
yeah.
chemistry. I tell people that all the time. There's a big difference between chemistry and biology.
Yeah, definitely.
I guess so. The obvious question is: are there any side effects then?
No, that's what I mean when I say they're very subtle. These are things that your body already makes. And I don't know. I always hesitate to say no when somebody asks me that question about something because there's always side effects to something.
Well, it could be unique to that one person.
Yeah, I mean,
because our chemistries are different.
Yeah, I suppose you could be allergic to some of the components, of a specific
It's very
peptide.
rare, though.
Probably the only side effect I can even think of is having an allergy to some of the components of something that you're getting.
But that's not a genuine side effect. That's unique to that one individual due
Right.
to an allergy.
Right, exactly.
That doesn't necessarily appeal to the masses where they need to be that concerned about.
There's really that's what's cool about it. It's for the most part, it really is all upside.
How long can they be used for?
There are, for instance, the secretagogues that we talked about. After you use them for a while, your brain kind of gets used to it, so you want to take a vacation from it.
Oh,
The way you take those is you take it Monday through Friday, and you take Saturday and Sunday off to kind of reset that thermostat. And then I always tell patients, if you're going to do this, do it for like 3 months and then take a month off. And there's no withdrawal or anything like that.
oh, that
They
was
don't
my.
feel-
That sounded like you would the way you were going on. I thought maybe if you did stop cold turkey, that you would get withdrawal.
No. You're just trying to reset the thermostat so then when they go back to it, it's working for them again.
Okay, so it's not something that you recommend taking every day then.
No, well, depends.
Like
Depends on the
take a week,
situation.
like take a weekend off. You're
Yeah,
saying.
it depends on the situation. Like BBC 157, you can take every day, but the secretagogues and what we were talking about before, those you really because you're stimulating your hypothalamus, you really need to give it a chance to kind of reset that thermostat. So,
I just. It sounds like they're incredibly useful. I mean,
They are.
this is something that.
We're on them.
Oh, are you really?
Yeah. Helps you sleep really well, too.
and it's physiologic sleep. It's not like ambient sleep. It's not Valium sleep.
Yeah, that's
You wake up
terrible
feeling
sleep.
refreshed. You really wake up feeling like you slept like a baby. It's
But
pretty
but is
amazing.
that why you take them to help you sleep?
Well, we're both on a we're trying to
Working
lose
out.
fat. We're working out, stuff like that. It's very helpful for belly fat, like I told you. And I'm a 65-year-old guy who's fighting belly fat. So I do it for that reason also.
We can talk about that all day.
Yeah, you can.
I know.
You can. There's different ones. There's one called Dihexa, which is an oral. It's a pill that you take that's very helpful for short-term memory. Crosses the blood-brain barrier. It's amazing.
So then it sounds like you could take, theoretically, tons, several of these for different purposes. Then,
I suppose, yeah.
and they won't interact with each other in a negative way and have an effect on
All
your
stuff
body.
your body already makes. It's all
Incredible.
stuff your body already makes. Yeah. You've got all the stuff that we were talking about. You've got circulating in your bloodstream in tiny little picogram quantities because they're all there to do a job. I heard a lecture once. The guy said that we make, I don't know where he came up with this number, but he said the human body makes 37,000 peptides. That's
Unique
a lot.
peptides.
Yeah.
Different types of peptides.
Yeah. Last time you heard about peptides was in high school.
Yes.
High school biology probably, or when you were learning about amino acids.
Or in college.
Yeah.
When I was in college, biology and
Yeah.
I just very little I remember from the biology classes. Sorry to tell you this, Doc, but I mean peptides. I remember we made dopamine.
Oh, really?
Yeah. Yeah.
Did you feel better after?
I should have, right? Maybe I did. I don't remember much of it, but I remember.
Gary, what's this stuff in your pocket? Never mind, Mom. Don't tell Dad.
Oh man, no. Hey, listen. You know, what's fascinating is that how and this kind of goes back to something we were talking about. Last week, how regenerative and how our body is a wonderment.
Oh, God, yeah.
It really is.
How it can heal itself, which we were talking last week, and how many peptides did you say? 137,000 or
whatever.
Whatever it was.
There's a lot of them. Yeah.
That's just, it's amazing.
Nothing comes close. You can talk about AI. You can kind of weld transistors together until the cows come home, and you're never going to come up with anything close to the human brain.
That's why we have to treat it well.
Yeah, that's why we got to treat it
and
right.
give it the right food and do the right things and not poison
Right,
ourselves.
but Francesca, you're 100% right. But there's a human aspect of it too, you know.
Well,
and
people don't know as well. People don't know what to do to nurture their bodies.
But you're right. You're right. But even there's some things people do know. I'll give you the most simple example is, smoking isn't good for you, but people not only do it, they start it now.
Yeah.
It's not one thing like it was back in, 60, 70 years ago when I heard it was bad for you. How could it be bad for you? It was fashionable.
Doctors recommend.
Oh,
Doctors
yeah.
recommend.
I smoked when I was young.
Doctors recommend it. Right. Go figure that out.
Stress.
Yeah, but we don't treat our bodies as well as
There's
And there's
just
certain
we should.
people.
there's
you're
just so
also-
much processed stuff, right?
Yeah.
Processed food. That's the problem.
There's another topic of
Yeah.
conversation that we can do thyroid. We could also talk about processed food and sodium and how that affects your body. Folks, you've been listening to HyperFit Radio MD. HyperFit MD Radio. I keep doing that. That's my bad, folks. HyperFit MD Radio show with Dr. Charles Guglin. I want you to reach out to him. It'll probably be the best call that you make all year long. And you can do that at area code 203-890-9777. I'll repeat that for you. Area code 203-890-9777. Check them out online as well. Really easy website. It's simply hyperfitmd.com. hyperfitmd.com. Poke around there, jot down a few notes. You might have to, in fact, maybe you'll get some questions that you've had answered. And who knows, if you're like me, it'll just provoke other ones. So that's why I encourage you to make the phone call. You can also shoot him an email, cguglinmd at hyperfitmdamc.com. Again, that's cguglinmd at hyperfitmdamc.com. And they're located in Milford at 88 Noble Avenue, Suite 105 in Milford. So for Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening to HyperFit MD Radio Show.